top 5 recommendations on how to have a healthier new year. Doctor, good morning again.
Good morning.
Happy New Year.
Happy New Year.
This is helpful stuff. A lot of people might think, well, there's a lot of things we try to do every year, but you got to remind yourself. Let's try. Number 5, if consuming alcohol, so if you're going to have a drink in moderation, we hear this every year.
Absolutely. In fact, recommendations are for men, no more than 2 drinks, and for women, no more than 1 drink a day. And obviously, like we said, if you're going to drink alcohol, you have to be very cautious. There's all kinds of ways to get around the day without driving your own vehicle.
Yeah.
The other important thing about alcohol consumption rule is significant health impacts. We know there are impacts upon the heart, increased incidence of cardiomyopathy, arrhythmias, increased risk for cirrhosis, for pancreatitis, which is associated with more increased incidence of diabetes, so some serious health risks.
We talk about 2 drinks a day is the minimum, but not everybody drinks every single day. Is there like a cumulative effect, or you can't like just bank all your drinks from the week if you didn't drink and then do them all on Saturday and Sunday,
because
right?
remember, the liver is the organ that actually filters, which is essentially a drug, so you can't overload the liver. Expect to bank
so if
it,
you don't drink Monday through Friday, you should still only do the 2 drinks on Saturday.
Exactly.
Got it. Good to know. Good to know. Okay, number 4, talk with your doctor about tobacco and nicotine use.
Yes.
And quit.
This is the year to quit. And there are some wonderful medications and treatments that are available for people that really are having a hard time. The other thing about tobacco consumption rule is secondhand smoke is a real risk factor. So if you can make your home smoke-free, your car smoke-free, children are increased incidence of asthmatics in people that smoke. So we really want to eliminate that as a health risk for 2019.
We know that telling people to quit smoking is nothing new, but yet it still makes the top 5 because it's still, that's how powerful that addiction is.
Very addictive, it is.
Boy, oh boy. Number 3, pain medication is personal. What do you mean by that?
It is. Well, as we know today, opioid is literally an epidemic nationwide. And if we're taking a pain medication that our doctors prescribe, make sure that we take it based upon the recommendations and don't give it to somebody else. Certainly, if you haven't finished it, you want to put it and store it in a safe place, keeping it away from children and other people. And if you aren't going to use it, discard it. You can take it to a local pharmacy and they'll get rid of it. But certainly you want to be very careful with that.
Get rid of those drugs. Don't keep them around for no reason. Number 2, over the last couple of years has become controversial, but this is about making sure your family is up to date on their vaccines.
It's so important, Raoul, not only for children, but also for us to remember that some people have this aversion to vaccinations. However, remember that it's not just you're immunizing your own children, but you're protecting other family members. It can be, your grandparents could be at risk, you could be at risk, and certainly that's a major factor. On a personal note, my daughter about a year ago had this really bad cough. She's a teenager, went on for about a week. We took her to a pediatrician, and of course all my kids are immunized, all 6 of them. So we went in and the doctor said, well, she's got whooping cough. I was like, wow, she got immunized for that. Exactly.
Really?
But it's not that effective long term, and she had to get a repeat immunization, and the family members had to get treated. So if we think of immunizations, they don't necessarily provide a lifetime immunity. That's why you do need to follow up with your family doctor and your pediatrician to stay up to date on current recommendations.
Good advice. Last but not least, number 1 is, this is near and dear to me because this is like my number 1 challenge. Manage stress, because this affects every aspect of your health.
It does, and as you know, Raoul, stress is a normal part of life, but how can we diminish it? And the simple things are, if we try to eat a healthier diet and we exercise regularly. We know that exercise reduces stress by releasing endorphins, cortisol levels, and overall just a sense of well-being. So those simple things can go a long way to reducing our stress next year.
I'll tell you what, we talked earlier, last hour, simple walk around the neighborhood, what it does for your mental health.
Huge
stress.
Effect.
Oh my
Definitely.
goodness. We'll try to stick to as many of those as possible. Doctor, we'll have you back, of course, to see how we're all doing. Dr. Chaffoo, thank you as always. All right, Happy New Year.
Happy New Year.